Dr.
Okay. Okay, I try to today I try to describe how to use the devices, the EHF devices for therapeutic purposes. As we heard last times, it's mostly the therapy purposes, therapy possibilities were mostly developed in Russia, because in Russia these devices are used at about nearly 30 years. This is Alexander Kozhemyakin. He was one of the developer and producer of this, or he is one of the developer and producer of these devices. And when I speak about EHF devices, I mostly speak about the devices from Sergei Kozhemyakin, which you can get more information in the GDV company about these kind of devices. Here we have the available products. There's a family of different products which can be used for different purposes. And we will focus our attention to the medical devices. Akaton is a trademark, and we have mostly two types. As a bigger device with an LCD screen which can realize 11 programs, and a smaller one which have 3 basic programs only. The advantages of the bigger device is that you can use different kinds of therapy. You can use the so-called noisy mode. That means a broad band of frequencies will apply to the biological object, to the human body, for instance, and the body will choose the resonance frequencies from this broad, noisy radiation. Then, on the other hand, you can use different oscillators which have frequencies. We will later speak about this, which have fixed frequencies to get in resonance with different kind of human or of body systems. Another advantage of the device is that it's working with batteries, so you are very mobile to use it, and there are not dangerous voltage during the therapy process. And now, last but not least, the device can realize the BRR therapy, background resonance radiation, which is unique for these devices. You can write information on the oscillators and then re-emit this information to human body, to different areas of the human body. There's a bigger pictures about these two devices, And in the lower part of the picture, you can see a device which is a non-medical device. It's mostly used to preventive purposes to lower the stress of the human body and to increase the abilities or the activities of the immune systems. Here you see the different, in the lower picture, you see the different oscillators. The yellow one is a broadband, noisy oscillators, and the other three have fixed frequencies. Fixed frequencies are 43 gigahertz or 7.1 millimeter wavelengths. This red one is widely used to influence the blood system. The green one, 53 gigahertz, is activating the immune system and the recovery possibilities of different tissues in the human body. And the blue one, 63 gigahertz, is mostly influencing the immune system. In addition, we have an oscillator which emits radiation in the infrared band of the, is close to the visible light band, from 0.9 to 1.2 micrometers. It's the near infrared light. This oscillator is used to support the activities of the 4 other oscillators. It's used parallel to the other oscillators to have a more intense therapy, more intense effect. The bigger apparatus, which has 11 modes of operation, I have a list here of this modes of operation. The first program is a universal EHF mode. That means with this program, which is running 10 minutes, you can have a radiation according to the frequencies of the oscillators of these small chips. And this radiation will be emitted during the whole process, the whole working process of the device. That means you can, with this program and with the oscillators, have a permanent radiation to the place where you fix the oscillators. The second mode is the so-called record mode with the subsequent BRR influence. That means this program is running 1 minute to fix the information of the different different areas of the human bodies, or you can even fix information from animals or from bacteria, and then re-emit, re-radiate this information to the human body. It's a process which is very positive and very useful to transfer information from different places or from different organisms to each other. How it will be practically used, you can remember as a general, let's say, non-scientific rule. The first program activate processes and the second program deactivate processes. For instance, if you have a small inflammation and you run the second mode and place the oscillator to this inflammation, you can see that the inflammation decreases subsequently. It's an effect which is widely used in physiotherapy, especially in Russia. You can ask questions about this to Irina Istomina, but I know that they use it in many cases. The problem or the thing is that not all facts about these processes, not all scientific background of these processes are clear now. There are different hypotheses, but not scientific studies which can fully describe why this second program works. But it works, it's proved by medical studies. The problem of medical studies is that I call them black box studies. That means they studied one group with this, that's second mode therapy, one group with placebo therapy, and one control group without therapy. And if you see that the therapy group is better than placebo and control, according to medical rules, it's evidence-based and can be used, but it's not clear why it's working in this way. And so mostly the scientific community is not very, or had many discussions and questions about these processes. But the practitioners, the medical practitioners know that it works. The programs 3 to 10, you can see that there are therapy named for different organs or different organ systems. For instance, the 5th program is therapy cardiovascular system, or the 6th, respiratory organs. These programs are in fact the basic frequency band of the first program, plus modulation of the so-called full frequencies in addition. Full frequencies means there was a German scientist, Dr. Voll, who found out that different low frequencies, starting with 7 Hertz up to 18 Hertz, can cause resonance effects in different organs or organ systems. And these resonance effects can be used to influence these organ systems and to therapy these organ systems. In Germany, this full theory and full practice is nearly forgotten. There are only a few therapists who are using these devices of Dr. Voll and this therapy. But in Russian, it's widely used, and these frequencies are used to therapy different kinds of diseases. So you can use the program from 3 to 10 if you are, let's say, a follower of Mr. or Dr. Voll, but you can use this 1 and 2, program 1 and 2 and program 11 independently if you are not ready to use the full theory and full therapy. Here you see how practical is realized the therapy. You connect a cable with this yellow oscillator to the basic device, and you place it on the area where you want to have your influence, or for a longer period you can fix it with a medical, how to say it, in leukoplast, and not to hold it the whole time of the therapy. If you have practice in therapy, you know, and it's a general rule, you must choose a strategy how to therapy different diseases, and mostly it makes sense to follow this strategy for a longer time. It doesn't make sense to mix different strategies of therapy, and that's why we now speak about the possible treatment strategies which can be realized with the Hackathon device. At first, some general therapy rules which are not singular for the EHF devices, but which are general rules for therapy at all. At the beginning, you must have an exact anamnesis and exact diagnosis. I say, or I point it out every time, because it's a basic for choosing the treatment strategies, and it's a basic which other methods you can combine with this EHF therapy. The second general rule is not to treat with this method decompensated states. Decompensated states means it's an unstable working situation of an organ or an organ system which can not maintain adequate physiological function. An example for such decompensated states is, for instance, a stroke, a brain stroke, or a heart infarct, heart stroke. These are states where, let's say, the system, the organ, could, under the influence of this treatment, go in different direction, not necessarily in the healing direction, but the influence with EHF, because of the unstable situation, can have negative process which gives no treatment, but gives up to organ, this organ can stop working under the influence of this. That's why decompensated states are not, or according to this rule, it's not, you can say it's forbidden to use this therapy in decompensated states. General, in this therapy, you must have a quiet environment and a relaxed position of the patient, because some of the processes lasted half an hour, and if the body is under stress because of environmental factors like noise or calls with mobile phone or something like this, the treatment may be not successful at all. If you have during the treatment acute symptoms like nausea, vomiting, dizziness, which can be happen for very sensitive person, then you must break the therapy. Or you can shorten the time of the therapy. In general, we must say that different persons have a different sensibility for low intensity electromagnetic radiation. Some persons are not sensitive at all, and for this, it's only a few persons, but for these persons, of course, the treatment will not be successful. Most of the persons have a normal sensitivity, and the treatment will be successful. And some persons are very sensitive to electromagnetic radiation. These persons normally describe you that they can't sleep in rooms with high voltage electrical wires, or they feel the influence of smartphone radiation. These very sensitive persons can have these acute systems, and then you must break the therapy, or you must shorten the time of the therapy. A fatigue is a positive signal. If you see your patient during the treatment show symptoms of fatigue, or even started to sleep, it shows you that the treatment is successful and influences the systems of the body. I spoke earlier that it's very important to develop a treatment strategy. This can be a treatment strategy like a monotherapy, that means only use the Acadon device and low intensity electromagnetic EHF radiation. This can be, for instance, if you want to treat local problems like small inflammations in the skin, or this to improve local microcirculation and so on, then you can use the device only. In other cases, you can combine the EHF therapy with medicamental, with drug therapy, with other methods of physiotherapy. Irina Istomina told me that they are working, for instance, very successful if you have deep hematomas after operations. They are working very successful with EHF therapy plus permanent electric field. So they combine different physiotherapeutic methods. It's the starting point to choose monotherapy or co-therapy, and then according to your preferable medical system or medical thinking, you have three possibilities, not only three, but three major possibilities. You can influence with a device the organs and organ systems, influencing the so-called projection zones. These projection zones, it's zones where you can influence via skin to deeper organ systems. They are mostly close or similar to the so-called dermatomes. That means the areas of the skin which are connected with different level of the nervous system. The second therapy strategy is therapy according to the rules of acupuncture, or the so-called biological active points. You know that the Chinese medicine have a lot of rules how to influence different systems of the human body via different points of acupuncture, and you can influence even parallel, not only one point, but several points to reach a result. And the third is the acute local therapy. I already spoke about inflammations, local inflammations. It can also be, let's say, insect bites, or it can be the so-called trigger points if you have problems with your muscle and with your movement. Therapy with project zones. For the beginner, this mode is easiest to use, and you can use the yellow oscillator. So you have influencing with a broad band of electromagnetic frequencies, and the organ systems will show a reaction going in resonance with some of these frequencies. To have to work with these project zones, it's helpful to have tables of modes and corresponding mode on the display of the device, so you can have a therapy session if you put an oscillator of the chosen zone, and then you can, if you want to activate the zone, run the first program, and if you want to deactivate the zone, you want the BRR second program. Here you have a picture with the zones known as useful for the EHF therapy, and a list which kind of diseases or problems you can influence with the help of these projection zones. I remember, again, if you want to activate the organ system and the organ, then you must use program 1, and then if you want to deactivate, you must use program 2, running 1 minute, and leave at the place the oscillator at minimum 30-40 minutes. Here are some examples how to use the projection zones for therapy. Today I give you only examples, short examples. More detail, we will speak about this in the following lectures, where we have in every lecture different diagnosis, and we will speak more detailed about the therapy, how to use EHF therapy. One example is cardiovascular system. You can use the device with program 5, 10 minutes, and depending on the diagnosis, you choose the projection zones and influence them with the help of program 5. Let's say if you have diagnosis and symptoms of heart ischemia, you will influence the 13 area and the in front and the 2 behind. You see from the pictures that these are areas very close to the heart, one on the back and one on the side of the body. You see, for other diagnoses, you use other projection zones. Another example, respiratory apparatus. If you have bronchitis, and diagnosis which often happens in this time in winter and spring, you can influence with program 6 the front area 1 and on the spine area 15 to influence the bronchitis and to free the trachea. Another example, as I told before, we will speak about this more detailed in the next lectures. Therapy according to the rules of acupuncture. This should be no difficult for therapists and physicians which are skilled in acupuncture therapy. So if one wants to work according to these rules, it makes sense to learn how to use the acupuncture therapy from an experienced therapist, because it's a very complex and difficult systems. But we can give some rules and some points which are more or less general for this acupuncture strategy. If we're working according to the acupuncture, so-called biological active points, we use the mode 11. The mode 11 has an modulation with low frequency, especially developed and fixed for these active points. The program 11 is used if we want to activate these points. If we want to deactivate these points, we use program 2 again. And general therapeutic method using the acupunctural points is the treatment of stress. To lower the stress in the body, gives some sedative and analgesic effects. It's helpful if you started all your therapeutic sessions with this treatment, because then the patient will be have lower stress and will be very quiet. We influence to lower the stress the point MC6, or in Chinese it's Neguan. For right-handed people on the right arm, for left-handed on the left arm. You must know, if you read in different lectures, that the names of the points are different. There is a French system which is mostly used in Russia. So if you read Russian literature, you will have the French points. And then there are second system with English names, and a third with German. So to choose the right point, you must be sure, if you read the publication, you must be sure which language and which system is used. Helpful in this case is if you give the Chinese transcription of the name, then you can find out the right point. Another point is the point GE4 or HEGU. It's again a point, if you influence this point with EHF radiation, you have an analgesic and anti-stress effect. To demonstrate this, I have an example: measurements with heart rate variability. Heart rate variability is a very good method to describe the regulation activities of the human body. It's widely used in sport medicine, and in Russia it's used for astronauts or cosmonauts to describe their workability during space flight and before and after space flight. And one of the parameters you see here is the so-called stress index. It shows the general, you see the arrow, the stress index SE, who shows you how much the regulation systems of the body are under stress. Here you see an example. The norm amounts should be between 50 and 150, and here you have a very high stress level. That means you have an ill person, or you have a very person under physical or mental load. So the regulation system is very under stress, very active. After treatment with EHF, the points named before, you see you can lower this stress level remarkable. In this case, we couldn't reach the normal level, but from more than 700, we went down to 566. It's a remarkable decrease in the biological regulation or regulational stress of the human body. So the heart rate variability is one of the methods which can show you that there is really a therapeutic effect from the EHF. Or EHF radiation with low intensity EHF radiation. As I told you, again, some examples: ischemic coronary heart disease. You have the typical symptoms: weakness, interruption in the work of the heart, the rhythm is damaged, and according to the rules of acupuncture, you will go with the EHF therapy, will influence the so-called heart meridian, especially the points C9 and C7. You can see them on the picture. And influencing these points, you will influence the working activity of the heart. stenocardia. It's other points which will be influenced. Especially the point E36, which is under the knee, is widely used to influence the heart activity. Irena Istolna can tell you a lot about how they use this point to change or to improve the stability of the heart rhythm and to lower blood pressure and eliminate the symptoms of the angina pectoris. Hypertonia. With these pictures, I want to show you that it's for different symptoms and different diagnoses. You have different points where you can proceed the therapy and which are helpful to improve the therapeutic situation. Here I can give you some additional information about the therapeutic procedures. There's a general rule: if you influence several points with the therapeutic device, that the sum of the active therapeutic influence time should be no more than 30 minutes per day. That means the first program and the programs 3 to 11 should be used in sum not more than 30 minutes per day. The program 2, there isn't such a limit, because this program has no activating functions but deactivating functions, and so it can be used very often, but the activating programs should be used less than no more than 30 minutes per day. And a normal treatment cycle lasts no more than 2 weeks. From economic reasons, in Russia they use at about 7 to 10 procedures, but you can use it up to 14, 15 procedures, and then must be a break with a period which has the same time, the same duration like your therapy cycle before. So that means if you had a therapy cycle of 10 procedures, 10 days, then you must have a break of 10 days after this therapy cycle. The reason is the so-called adaptation process. The biological system, the human body, is able to adapt to low intensity radiation, transforming the systems of the body. And so if you have a permanent influence over a long time, the therapeutic effect will be decreased up to 0. You can compare it with sitting in the sun during the summer. At the very beginning, you have a very big influence of the sun, of the radiation, up to inflammation and red skin. But if you have all the time working outside or sitting on the sea, you have an adaptation of the body, and at the end of the summer you have no influence of the sun. It's a little bit a simple example, but it shows what I mean with the so-called adaptation process. I already told you that the standard treatments in acupuncture is realized with program 11, and program 1 is activating the meridian energy, and program 2 is lowering the meridian energy. Program 2 is used running the program 1 minute and then leave the oscillator on the place at minimum 30-40 minutes, but you can leave them up to 2 hours. Then you must rerun the program 2, because under the influence of your treatment, the system has changed, and you must repeat the registration of the information. At last, the therapy of acute systems and local effects. This is mostly pain in muscles, bones, in connective tissues. You can influence with program 1 directly to these points. If you want to activate the tissue, for instance, fascial tissue, then you use program 1. If you want deactivate, for instance, muscle activities or the so-called trigger points in muscles, trigger points are very painful, hard fixed points in the muscle. If you can find them, you can deactivate them using program 2. The other possibility to use or to therapy of local acute systems is local inflammation. These are inflammations directly under the skin. To stop or to decrease the inflammation process, you use program 2, and it's helpful not only for inflammation, but it's helpful for insect bites, for instance. In summer, if you have a bite of a mosquito or of a honeybee, and you put the oscillator on the place and run program 2, it's immediately decrease the local effect and the pain. The other effect is microcirculation. Here you can have all positive effects which are caused by better circulation of blood and blood serum in the place. It started with cosmetic effects. You can have a better skin, and you can have an improved possibility to put your cosmetics in the skin. You can have a shorter time and a better distribution of local hematomes. You can have all effects which are connected with better microcirculation. A special case of improved microcirculations which are very, very surprising and very, very helpful after surgery, but also after diabetic complications, necrosis, local infections, which complicates the wound healing. It's again the local effect. You put the oscillators on the place and you are running program 1. if you are damaged skin, there is open wound, it's forbidden to put the oscillators immediately on the wound. So in case of surgery or necrotic open skin, you must put the oscillators around these places. And to show you some effects of the acute therapy, here you see why there is a better microcirculation. If you influence native blood, you can see that after the treatment you destroyed the so-called staples of coins. You have separated erythrocytes which are able better to go through the micro vessels in the skin and in the tissues. And again, the same effect. Here you have an example how you can improve the wound healing. It's one of the pictures from Irina Istomina. She has a gallery of such strange, horrible photos, but it shows the very positive effects. If you see on the left-hand side, there are a deep wound with necrotic effects and infected. And after 5 days treatment, you see the black areas are now red. The microcirculation is improved and the healing process started. So even in cases when normal diagnosis said that it's impossible to heal these wounds without surgery, without operation, it shows that it's helpful to have the EHF support for healing process. Here are some recommendations how to use up to now we spoke about the broadband yellow oscillators. Now we can some recommendations how to use the EHF therapy with fixed frequencies. There are different diseases and effects, and you can see that it could be helpful in this cases to use the fixed wavelengths. That means 7 and 1 is the red oscillators, 5 and 6 is the green one, and 4 and 9 is the blue one. Here you can see that the device is used in veterinary medicine too. The veterinary physicians, they use them mostly according to the rules of acupuncture. There's a field called animal acupuncture, and you can use the device in these fields of therapy too. This is a bracelet I showed you before. As you see, with a bracelet you can influence the big vessels of the hand wrists and the point of the stress, lowering the stress, and that's why it's helpful for preventive measures to improve the blood circulation, improve the activity of the immune system, and to lower the physiological stress of the human body. But this is a non-medical device. And now at the very end of my short presentation, a new device which is as an innovative technique. We connected all electronic elements in this red chip called MyStone, and this red chip is controlled by an excuse me, by a smartphone app. The smartphone app is available for Android systems and for Apple iOS systems. We have 6 programs. We have Skin Beauty, Pro Skin Care, Skin Relaxation. These are the programs, or the background of these programs are the improvement of the microcirculation. So with the help of these programs, you can improve the activities of different creams, and you can improve the local blood flow and the transportation of different kinds of how to say it in English, participants of the biochemical processes in the skin. The following 3 programs, Pimple X, Anti-Stress, Immune Pro, it's again the programs for lowering local inflammations, that's why Pimple X, and to lower the stress and to activate the immune system in the body. This is a non-medical device. Again, of course, if you understand my lecture, it's clear that you can use it for medical purposes too, because these are the same programs and the same frequencies used in medical devices. The only difference is that up to now this device has no medical certificate, because we must run a study or several studies to show that the effect is the same like in the other devices. And you know that this medical studies are very expensive area, very expensive feature. That's why up to now we get only and health and beauty milestone, but I know that most of the users of this device, they use them for pain, for instance, users too. Skin Beauty, I told you we have an improved microcirculation, and so the tissue in the skin are provided with optimal minerals, oxygens, nutrients, and waste products are taken away. So we have an improved cell renewal. Pro Skin Care is the improved effectiveness of skincare products, because it's easier to transport them into the skin and to transport them to the place where they are developed their influence. Pimple X, I told you, it's inflammation suppressing and a better immune response on the place, because it's a better transport of immune cells to the local inflammation. Anti-stress, again, on the hand wrist, and Immune Pro on the middle, influence of the middle of the sternum, where is a general meridian to activate the immune system. It's my short presentation. If you have some questions according the therapy and the therapy strategy, you can ask them now. As I told before, for different organ systems and different diagnoses, we will give examples and lectures during our next meetings, our next webinars.
So I have a question.
Yeah.
Please, when you compare acupuncture therapies with needles and the way you have shown now with waves, with high frequency waves, what is the difference? What do you mean?
I'm not a specialist in acupuncture, but I can't see any difference because what we have biological active points which you can measure. For instance, with electric activities, you can show where the point is, and with different influences you can activate or deactivate these points. One possibility is to do it mechanically with needles. Another possibility is to do it with laser light. There's a so-called laser acupuncture. And another activity or another possibility is to use this EHF, low intensity radiation. In my understanding and as far as I have analyzed the literature, the main or the central point is to activate these points, and how you do it physically. It's the experience and the let's say the experience of the therapist.
Yeah.
What the therapist prefer to do.
What I mean is, with the needle, you can go very deep. How deep you can come into the body with these waves, with this,
Yeah. You know, there is one of the problems under discussions among the scientists engaged in this field, because if you look at the human body, you have an amount of about 80% of water in the tissue, especially in the skin. And water in this frequency range we speak about have high absorption bands. So looking to the pure physics, you must wait that this radiation goes about 1 millimeter in depth. In this, you can reach some structures of the skin, of the dermis, the so-called free nerve ends, some microvessels, some immune cells, especially mast cells. But there are other scientists who are speaking about special skin effects on the cellular membrane, and these skin effects, which are working only with very high frequencies, have the possibility that along the membrane of the cells, the radiation is going much deeper in the body. But there are some publications, but not a full developed theory about this.
Okay.
And the most exotic description how it works It's given by Deviatkov, a Russian physicist, who speak about the so-called linear waves, or waves not electromagnetic but electromechanic. That means the electrical waves is transforming to a mechanical, and then again to the electrical, and the result are the so-called scalar waves. In Germany, this theory is supported, as far as I know, only by one scientist. It's Professor Meyer. The problem is these waves are under discussion, but if they exist really, then the whole building of the field theory is under pressure and must be reconstructed. That's why in the moment doesn't exist any full theory how this kind of radiation is influencing the biological processes. But what we know for sure is that the acupunctural strategy is working similar like the needle acupuncture and like the laser acupuncture. But we can't fully describe why it's working.
Thank you.
Okay, some more questions? Or?
Yeah, Dr. Lieder, I have one. Regarding charging water. I know on the last lecture it was mentioned that to charge water takes 1 minute in a small quantity of water. If you apply the oscillator to like a large jar of water, say a couple of gallons, and you leave the frequency run for 10 minutes, will that still charge that quantity of water? And does it clear fluoride from the water?
The influence of this kind of radiation to the water structure is one of the effects which were shown, and we are now running a project how we can use this kind of radiation, for instance, in aquaculture, to improve the homeostasis of aquacultural fish, because in the moment we have no medicaments, no drugs to healing fish for nutrition purposes. The only drugs allowed in the European Union are for fish for decorative purposes, this aquarium. But nutrition, there are no drugs, especially which can be used in aquaculture. That's why if there are in the aquaculture some infections, the result will be a fully, all the fish will be damaged by this infection because no healing is possible. And we try to find out a way. What I can say, that this kind of radiation influence the water structure, it's shown by different publications. One of the possible ways why this therapy works is that it changes the water in the biological tissue, especially the so-called water or around the structure of proteins. There is a soluble water which is connected to this biomolecule, and the structure of this solutions influence the activity of these proteins and enzymes. So to structure a smaller amount of water, you can use these medical devices. For structuring bigger amounts of water, up to 3 liters, we have a different device which is called activator, water activator. And using this device, you can activate for water for drinking or water for preparing solutions. It was shown that, for instance, disinfection solutions of disinfectants are more effective if they were treated with this kind of radiation. But for this treatment of bigger amounts of water, you need a higher intensity, and that's why it's better to use the other device, the so-called activator.
Mm-hmm. Okay, thank you.
Okay. If there are no questions, we could stop here, or what do you think?
Okay, thank you very much, Dr. Zenke, and we'll be looking forward to your next lecture.
Thank you very much. And we agree the schedule and the content of the next webinars. And then, and we must agree maybe a time a little bit later, half an hour later, because in Moscow there is another time, and Istomina, if she's working during our webinar time, she must hurry